The management of the St. Anne's Bay Hospital says it has partnered with other facilities in the region to help treat patients. This follows an increase in the number of patients seeking care since Melissa impacted the parish and Falmouth. Damage to the Falmouth Hospital meant some patients had to be transferred to St. Anne. Chief Executive Officer Dennis Morgan says the team has been getting additional support to treat with the surge.
We are getting support from our primary care partners, so where there are clinics in certain communities in the Northeast region for whatever reason sustain damage and are unable to operate, the doctors and the nurses who would normally staff those clinics are now at the St. Anne's Bay Hospital providing that care. And what that shows is a level of collaboration and cooperation, because when something happens, as I said, healthcare is a collaborative effort. So we're not out there on an island by ourselves.
When pressed about the sustainability of the current measures and how long the facility would be able to continue, Mr. Morgan gave this response.
The short answer, for as long as it takes. We are in health, and we don't have the luxury of picking and choosing who comes to our facility and when they leave. So as long as it takes. The good thing, however, is that we're getting support from the national network, healthcare network, in terms of the Ministry of Health, our regional regional health authorities, both Sierra and our very own NERA is giving us the support that we need to carry on.